This week's Ask Dr. Dury comes from a patient who is a member of a support group and wants to know how much can we learn from looking at all of the experiences of the myeloma patients within a support group. This is a very good and important question, and the first answer is that we definitely can learn quite a lot from looking at the experiences of all the different patients who might be within a support group with maybe 50 patients or even as many as 100 patients. There will be patients within the group who have had an autologous stem cell transplant and have had a fantastic response and have been in remission for many years. And so this very positive experience, where it may have been well tolerated and produced an excellent outcome, is very, very helpful to a new patient considering that approach. Likewise, there can be many experiences of patients who have done very well later in the disease, having fantastic and long remissions after a second or a third relapse, and this can obviously be very reassuring for other members of a support group. Likewise, over the years, there can be many experiences with toxicities and side effects of many of the medications that we use. And so this feedback from other members can help to guide the other support group members to avoid side effects or treat them in the best fashion possible. However, although this is definitely the case, it's important to realize that because every patient is different and in the private practice treatment setting, each patient is treated a little bit differently, and so you can't look at the outcomes for the whole support group in any collective way because all of the treatments are so different and the patient experiences are different. And so to look at things in a more collective fashion, we have to look at true clinical trials. In a clinical trial, all the baseline testing is standardized, and obviously the dosing and the scheduling of all the drugs within a clinical trial are sequenced to be the same and matched. And so in this setting, one can truly compare the outcomes for different types of patients using the same treatment approach. And so the bottom line for this questioner is that absolutely one can learn a lot and be supported by the information and experiences within a support group.